Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. This is Pregnancy to Parenting. I'm Koa Solomon, and as we know, the first few episodes, it seems like alhamdulillah, the chain is slowly traveling, but now traveling to trimester 2. So shukran so much for those that have joined us throughout these shows in this series of Pregnancy to Parenting. We joined once again by Dr. Malika van der Skeep, obstetrician and gynecologist here in Cape Town, practicing in the southern suburbs, Constantiaberg and Rondebosch Medical Center. Assalamu alaikum to you, Dr.
Wa alaikum salam wa rahmatullahi wa barakatuh.
So looking at where we are now, we're somewhere there in the middle. This journey is slowly but surely getting there. The belly is getting a bit bigger. The excitement
Baby started to kick.
Lots of kicking, no more fluttering, alhamdulillah, so we can feel the movements. And just before the show, before this, we looked at some of the minor ailments that does occur during this mid-pregnancy stage. So we looked at the backache and some of the UTIs, urinary tract infections, some of the infections, and going to the toilet every time.
Absolutely.
Yeah. Okay. So any other minor ailments we should still be looking out for could happen within the second trimester?
I think, the minor ailments that, as you're heading out of the second, out of mid-pregnancy towards the end of the second trimester into the third trimester. So from, 24 weeks onwards, your backache can worsen, as we'd mentioned before. You can definitely also end up having a lot more indigestion. That belly is starting to grow. It's starting to push up. So your heartburn, your indigestion, you're not being able to have a big meal, feeling full earlier. Those will definitely set in because of just basically a lack of space. Also, you tend to make a little more gastric acids in the pregnancy as well. So you often have patients that will say to you, heartburn has become, an issue. And, there's some very popular products that are being advertised on TV and in the pharmacies that are just, strictly made to try and alleviate that heartburn as well. And products that you can have before a meal as well, just to kind of try and prevent that. And sometimes you can have that symptom, which is actually a symptom of what we call a hiatus hernia, which is when your stomach is actually kind of pushed almost into a little bit of it is pushed into the chest cavity, so it herniates up into the chest cavity. Those patients might describe that they feel a fullness here, they might have heartburn, or they might even have some projectile vomiting or vomiting that's happening without the nausea, that they actually vomit after meals, and with that can just have your very, very small meals.
Do you find that there could be a danger diarrhea within pregnancy, whether it be the first or the second?
Yes. We spoke in the first trimester about how, there's certain diarrheas that can be a problem linked, diarrheal illness that can be linked to food poisoning. So your stomach is a little more sensitive. You might find that everybody in the house had something, but you're the only one that reacted. Everybody else had the odd cramps, but you ended up having really bad spasms and cramps and vomiting. There's also, some of these bugs that are going around, especially in the summer months, where you're prone to gastro, where that's concerned. And sometimes it can be linked as a reaction to medication as well.
Okay. Right, so those are the all unprettiness of the honeymoon phase.
Absolutely.
So let's get to the scientific beauty of our scans and what we are able to see within this mid-trimester of our pregnancy.
These are often the very nicest scans because your child still fits onto the screen. You can still see practically most of it. And what's so lovely about this stage and phase is that as patients come, they will say, they're so shocked and it just starts to feel a lot more real because this child is now probably this kind of 400, 500, 600 gram child mid-pregnancy, looking like you can actually see the feature of the nose, you can start to see the shape of the chin, you can start to see lots of things, and they really do start looking like little humans in there with little chubby cheeks and, little fat thighs and things. So that works out. That's very nice to see.
Maybe a wave.
Absolutely. They have a wave. They have a sign. I've got some ugly signs that some kids do in the womb, some peace signs. So yes, I've got some pictures of those. But one of the vital things about the scans in the second trimester is that mid-trimester scan. So with the mid-trimester scan, when the organs have grown, so your organs are now grown, you've gone beyond that phase of that first trimester scan where we looked at viability, where they were looking at evidence for Down syndrome, as I was mentioning, about the nasal bones, about the thickness behind the neck, that kind of thing. We now head into the second trimester, which is an ideal time between 20 and 22 weeks. Now remember, 20 weeks is smack bang in the middle of the pregnancy, so it's 4.5 months, and that's a good idea. 22 weeks is 5 months by our standards, so it is a good time for that fetal abnormality or fetal anomaly scan to take place.
So this is the second one.
Yeah, this is the second big fetal anomaly, abnormality or assessment scan that happens in a pregnancy. And it can be anywhere from 30 to 45 minutes long, where they will look at, everything absolutely from head straight down to toe. So they would look at, for example, 9 or 12 views of the head, 9 or 12 views of the heart, depending on, on everything. They don't just look at the heart itself and look at the 4 chambers. They actually follow as those chambers come out. Do they connect to the correct blood vessels? Because you can have certain variations or alterations in a pregnancy where you have a transposition of the vessels, or basically like a twisting of the heart and the blood vessels. That's a problem. And the cardiac or the heart abnormalities is the one place in that second trimester that I like to have reassurance that it is fine, because they really do comprehensively look at that. They also do look at the spine to see that it has still continued to close. There's no evidence of spina bifida. They look at everything from head to toe. Count the little fingers, count the toes, other than all your measurements. Check that there is a stomach bubble the way they're supposed to be. And, heart murmurs and things are very difficult to hear in kids. They sometimes don't manifest immediately at birth, and they might manifest later on when the child suddenly turns blue, or there's suddenly some problem where the baby is very short of breath or very pale or problem. So these things actually, you can try and preempt some of the problems that might happen in those first few months of life, because they can absolutely, give you guidance where that's concerned, and try and allow you to perhaps preempt. So for example, if you end up having a problem with the kidneys, if I just choose an example, you might have a kinking or narrowing of that kidney, and they might mention it on scans. And then what happens is, we know that patient, we will have do the scan, and actually when the baby is born, within the first 6 months of life, kind of follow through, check, is that kidney okay, is it okay? Not kind of figure it out after they've had frequent infections. Or for example, the stomach, if we sometimes see a double bubble in the stomach and not just a single stomach bubble, what that will alert you to is that there's a narrowing of that stomach. Sometimes you might be alerted to that when the patient ends up having projectile vomiting, and well, now the fetus, now when we're now actually a little baby and outside, they might end up having some projectile vomiting, and that might alert you to it. But you can sometimes preempt it in the womb. So that is sometimes the method behind doing your second level, or it's called a level 3 scan, but your second trimester scan, looking at all of those abnormalities. Of course, at this time you're also looking to see, is the placenta low? What is actually happening placental wise? What is actually happening? Has it moved down? Is it moving up? Because sometimes a low-lying placenta can also be a cause for bleeding in that second trimester.
Okay. Now, this is the big scan that happens after them. Is it always recommended?
Look, it's a choice. Some of my patients say, it's not within my budget. Some of my patients would say, you're scanning every visit. If there's something abnormal, please refer us further, but short of that, don't want to know. Some people say, not interested in the information, I'll take it as it comes, tawakkal to see. So it is a choice, but you will find that you will be counseled towards it. And you must always realize, with any of your medical consultation, it's a choice, that you have within this consultation, and you need to ask, should I, shouldn't I, why not, that kind of thing.
I'm just taking myself back to one of my scans that I did at the fetal assessment center, and one was that which was so beautiful that they could actually say, oh, your baby's quite slender, or look at nice features. So those
or tall or short. Yes, absolutely.
With the niceties of those.
Make no mistake, it's a very pretty and a very cute scan, and sometimes a nice memorable memory to have on media, on DVD or something, but that shouldn't be the reason we go for it. It ideally is going to give you accurate information. And a lot of patients will tell you they are quite nervous during the whole thing. They'll be looking at the head and kind of looking at the whole thing and looking at the heart, and with each scan, as you go through each sector and segment, it's like patients will say to me, I was holding my breath, and then, she said, oh, everything with the head is fine, or everything with the heart is fine. And as you go, I know. And they're sometimes silent when they do it as well. So very stern looking. And you're automatically thinking, ooh, she's doing something wrong. or they think that, some inhalation or gasp or breath means that there's something wrong now.
It can be quite nerve-wracking.
No, alhamdulillah, it's a beautiful process when everything is absolutely fine. And I think, we forget that things can go horribly wrong. And sometimes those beautiful scans are a good kind of reminder that alhamdulillah, the might of Allah, of how wonderful it is when everything forms, grows, and is absolutely perfect with your anomaly scan.
Alhamdulillah. To leave it there with the beauty of the creation of life, alhamdulillah, looking at the second trimester and the very important fetal assessment scan that you could possibly go for. More on pregnancy to parenting after this. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. I'm Koa Solomon, and we welcome back once again gynecologist and obstetrician Dr. Malika van der Skeep here in Cape Town with rooms in Rondebosch Medical Center and Sandford. Welcome back, Doctor.
Thank you.
So we're in the second trimester and we're talking about the beautiful scans that we can see and the pictures that are taken and the fetal assessment scan as well, and how precise that is, alhamdulillah, and appreciating the beauty of life and this creation.
Yes.
Now, within the second trimester, this beautiful being is being formed. Take us through what is actually happening within, what is actually forming on the surface.
We've mentioned before that obviously organs and things are placed. Skeleton has formed, the skin is very thin over the skeleton, and that's why they often have that little alien or skeleton look in the first trimester or as you're heading into the second trimester. But they start to form a lot more fat under the skin, so you can start seeing cheeks, you can start seeing, shape of the nose, which sometimes parents are quite keen to kind of know, or fat on the bones, so to speak. So you can start seeing and the muscles are also growing and getting bigger in size. So, sometimes if that kid is busy waving at you, you can see a little baby bicep forming or something like that. You're looking at the feet, you can start seeing their shape and things. And of course you can see toes and things, but now they just start looking a little more human where that's concerned. Hair is starting to grow, and there comes, the myth of, oh my goodness, I have heartburn, this child's going to have a lot of hair, and those things that patients are often telling me. I think so. but a lot of people will really, really believe it to be true. Although I must say a lot of our population and patients definitely do not end up having these baldy babies. We often have these beautiful babies born, mashallah, with lots of like a big thick head of mashallah hair. And so that definitely, the eyelashes are forming, eyebrows, and the eyes, and in and around. So the eyes are obviously there, and the eyelids, but your eyelids only really flutter and open from about 24 weeks, so 5.5 months. Also, in and around that stage of about 5.5 months, that child is starting to hear. And actually, as early as that, its little taste buds are starting. Look, it's not like there's like lots to taste in the womb that's different, but it's forming. And then hearing is starting. Now, they can start to hear. And so, talking to your child, even although the science tells you that they only start to hear from about mid-pregnancy onwards, I don't think it's a bad idea to keep talking to your child from the beginning of the pregnancy, or chat to them or recite to them or things like that. But you will often find that hearing starts at 24-ish kind of weeks, but they're only in the 30s can start to distinguish sounds. So I'll speak to parents and they will say, my child was quiet for a moment, and then his or her father started speaking to him, to my stomach, and going, listen, don't give your mother problems.
So
recognizing and distinguishing sounds that they can actually hear. And this is where sometimes they talk about stimulating that pregnancy as well at that stage, because that child is hearing, and and there's evidence that in the as we head into the 30s of weeks of pregnancy, that kind of thing, they're actually comprehending at that stage. Your fetal movements at this stage is starting, and it really is also as you head into the 3rd trimester and further along, your baby is going to get into that pattern. So I will sometimes end up asking patients, what kind of pattern is your baby in? And they'll say, my child's awake all night and sleeps during the day, kind of thing, which I think sometimes can be bad news, because that might be the same pattern they're in when they're actually out of the womb. Absolutely, because patients will come with really tired expressions and rings under their eyes, saying absolutely with no sleep, saying this child is awake between 2 and 4 and she did this in the womb, that kind of thing. So those are subtle things.
So training now already.
Absolutely. And your child will move when he or she knows they have your attention. Also, because sometimes you don't even know your child is moving when it's actually when you're busy. So we say, please judge and assess your fetal movements when you are actually more at rest.
That's one thing I struggled with when they said to me, oh, but so how many times did your baby move this week? Or,
yes, or this day or something, yes.
I don't actually know, So you only realize it when you're lying down or when you're
actually
so when you're up and about, whether you're driving or in the kitchen or working, you don't actually know.
And that's
how important is that?
That's why the advice is have a seat, sit still, make yourself something, preferably something sweet. Later on, I'll talk about why some sweet things are not a good thing. But for now, have something to eat or drink, sit calmly, and in that half an hour that you're relaxing, your child should at least be moving, should be moving and should at least be moving 10 times. Now, I know that sounds like, oh, wow, I'm going to have 10 kicks and somersaults and movements. I'm talking about 10 signs of life, the odd little twitch, kind of spasm, that kind of thing that you're actually seeing.
You need to feel that within that half an hour.
Absolutely. Later on, that becomes important. And as we speak about kicks and kicking, later on when we speak about the 3rd trimester, it is not just precisely, you read my mind. I was meaning that towards the end, it is not these hectic kicks and kicking and violent movements, and sometimes those bumps that you can actually start seeing, absolutely, where you can actually feel an elbow or knee sticking out there. They actually do then actually become more subtle movements. And I know that I'm saying it again, but it puts it in perspective. It's signs of life. And if you're not sure, go and check it out. Go and check it out at your maternity center or something. Do not just leave poor fetal movement or lack of fetal movements, because it can be a danger sign. Yeah.
So we're talking about the actual formation of the body here and the movements, looking at completely what is forming. So is everything there? It just needs to grow from here.
Absolutely, yeah. Vital organs are there. Vital organs should be formed. They need to grow in there. They need their differentiation and their growth. So your lungs are there, but they haven't quite matured.
Okay.
Sometimes right towards them, the breathing movements might start, but it doesn't mean your child's equipped to breathing yet.
Okay.
So we're still at that early stage of second trimester as we're heading into the third trimester of calling it still viable or not, because once you start getting towards 26 weeks or the third trimester, when you're actually anywhere between 800 grams to a kilogram, that you actually where we are size wise at that stage.
Okay, so this is something that always comes up in every trimester, and looking at the second trimester's danger signs. Are there any problematic areas and problems that you would find within the second trimester?
This still falls within the stage of calling this pregnancy loss a miscarriage. It would be a mid-trimester loss. And your losses here are different to the first trimester because you have a formed child. You've got a weight of, for example, anywhere between 400 or 500 grams. And those losses, sometimes your reasons are different. You can have unexplained stillbirths or because of bad infection or an infection, that a congenital infection that happens that can affect you and cause infection with the baby. And, for example, a stillbirth or a stillborn, basically fetal demise in the womb at about between 18 and 22, 24 weeks. And then you can have the situation where you might get triggered into labor for quite a few different reasons, but two of the big reasons are if there is, for example, cervical incompetence, or if there is any infection around that specifically attacks that cervix and causes it to open prematurely. Well, cervical incompetence could be shortening of the cervix. So it's shortening, and as that head or the pressure is pushing against that head, you actually have that cervix just kind of gives, so to speak. So it's incompetent, it's not closing. And that sometimes you can be alerted to in the late first trimester. Unfortunately, sometimes we only figure those things out after a loss has occurred. And how do you know that? It's something where you have this loss, but it's absolutely quick. You might just have cramps, pains, heaviness, and a few hours later you've delivered, And of course, at that kind of small weight, under, 800 grams, there's not much you can do, viability wise, or in the nursery where that kind of thing, where that is concerned. So that would be cervical incompetence.
Has there been cases where it's come to you where they have to actually stitch them on?
Those are the cases where that stitch can happen outside of pregnancy or during the pregnancy. Obviously in the very late first trimester or early second trimester, that suture would be placed into the cervix. And it's not without its risks, obviously, because placing the suture itself could put you at risk of preterm labor because it needs to be placed under anesthetic with you anesthetized, having gone through the anesthetic. And as I mentioned a few episodes ago, that the second trimester is where you can handle stress. We still worry that labor might be the issue. So that would be if you had some physical abnormality with that incompetence, with the cervix.
Shukran, Dr. Malika. We'll be back with you right after the break. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. With me once again is Dr. Monica van Escape, gynae and obstetrician here in Cape Town. Welcome back, Dr. Monica. Just before the break, we were chatting about the complications within the second trimester, cervical incompetence. Right. Now, miscarriages do happen sometimes within the second trimester. We haven't quite touched on multiple births. Could that possibly be a reason for miscarriages as well?
Absolutely. Multiple pregnancies, and of course this I mean twins, triplets and beyond.
Okay.
Sometimes just because of the sheer pressure of it. Sometimes because you can have a bleed for the placenta. You can have the placenta laying too low. You can have pressure and that forcing that cervix open. Or, for example, with twins or triplets or bigger pregnancies, that the body just can't handle that kind of weight, or pressure down. So these are pretty acute pregnancies, inshallah, if they go well, alhamdulillah, but there are danger pregnancies where these are the phases. You kind of want a pregnancy to get to 26, 28 weeks. Not that anybody wants their baby born at 26 or 28 weeks, but that is still considered viable for a nursery, for the ICU or the neonatal ICU to actually deal with a baby. Before that they really can't deal with things with lungs and things. And yes, there are stories, alhamdulillah, where babies have survived at a very young age or at a very young weight, but sometimes these are more the exceptions than the rules.
Okay, like I said, we haven't touched on multiple births, so
yes,
give us some guidelines with regards to multiple births. From the beginning stages.
Shortcut, it's double trouble. Shortcut, it's just that everything. Shortcut, it's double trouble. So the minor ailments we spoke about before. If we take it right back to the first trimester, obviously you are more at risk of miscarrying. Sometimes you're more at risk of miscarrying a single one or the other, because some people, you'll have friends or someone you've spoken to who say, I was a twin, but very early on in the pregnancy my mother bled and only one survived and I was that one. Or you might find that there is also, especially with assisted reproduction that we were speaking about, there are fetal abnormalities that you need to look out for with twins where they are. And I mean, we could base an entire program just on twins and the complications of identical, non-identical. Do both of them have their same sacs? Are both of them in the same sac? Do both of them have, is there two placentas and two sacs, one sac, that kind of thing. So there are complications linked to that. The minor ailments that I had mentioned before just worsen. So, for example, your anemia is almost certainly worse. One of the things we haven't touched on, which actually hits in the third trimester a lot more, is swelling of the legs. And that's going to be a lot worse. Varicose veins that might happen in the late second trimester or early third trimester is much worse. Constipation, hemorrhoids, diarrhea, those things, are just absolutely hypertrophied and just amplified and exaggerated. We also check at that stage, as you're heading into the later part of the second trimester, hypertension, could that potentially kick in? High blood pressure in pregnancy. I mean, I know those are things that, you've proposed we chat about when we deal with medical disorders in pregnancies. And so it's that, and it's mostly preterm labor where twins or multiple births are concerned.
Now we know that twins does sometimes run in the family. Is it always that expectation when they're twin, or there's something in the family?
Well, one of the family histories I always ask about is there any family history of twins? I sometimes cordon off that question, because sometimes I say it and then most patients go like ashen or white, or oh my goodness, I haven't thought about that. So yes, definitely families, it can run in families, but these days often we find that they can also be linked to fertility and fertility treatment.
Okay. Now coming to that, twins are more, multiple pregnancy are more common today than they were a few years back because of that?
So, yeah, we do have multiple births linked to that. And I mean, obviously, I think that's kind of like a double blessing.
Yeah.
But those pregnancies sometimes also statistically can be fraught with a lot more complications.
Okay. So just be more exciting it is, the more
Absolutely.
Yeah.
And, we kind of, I always set markers to the patient. We kind of hold our breath till we get through the markers, kind of like we've gone through the first trimester, we've gone through half of the pregnancy. We're there at, the third trimester, or in the 30s when you almost, kind of exhale a little bit.
So alhamdulillah, the Almighty has granted us to carry through to the second trimester. We're looking very healthy, baby's looking good, alhamdulillah, all is going well. Are there any changes in our diet and exercise and routine and daily things that we should and should not be doing within the second trimester now, later in mid-pregnancy?
I think now you're actually dealing with the obstructed issues, as in you actually are bigger, you're growing, you're more exhausted. It is a matter of, is my chair still comfortable? Can I drive comfortably? It's a matter of, it was fine perhaps in that honeymoon phase to do all the cardio at the gym, but can you actually still, do that? And I think a lot of it is balancing those minor ailments, that we were talking about as well. So I think those are changes that the body is going through as well. And to modify everything, I think, is you're slowly starting to realize that some of those third trimester things might be creeping in. As I said, the leg cramps might, kick in now. Of course, modifying the bed, trying to find a comfortable space to sleep in, because whereas before you might have been quite comfortable being on your side completely, you're actually not anymore because of space. So often you'll find, and I'm not sure how you need to give me advice and tell me about, some of the husbands have come and they've complained that there's no place for me in the bed, there's too many pillows in the bed, or, you get some of these fancy pillows, the kind of snake type pillows. And we need a kind of demo model here so I can show you. But often women need to realize, yes, you should not be flat on your back. But you also don't need to amputate your hip by going completely to your side, and then feeling as though you're so uncomfortable and really sore because you're completely weighted almost vertically, like on your side. You can just tilt off your back a little bit and put a pillow in the small of your back, and just kind of, that can guide you as well. So you're just slightly off your back.
Okay, so I must have to that advice was exactly how I had to find myself lying in bed when I went through my pregnancies, especially now the recent one, looking at where I did have pillows like that I knew that would be between my legs or the small of my back and just under my tummy. Little pillows everywhere, but that snake-like pillow does help. You can make it with a blanket even.
Absolutely, and you can have a rolled up towel or blanket that actually does that for you as well.
What are the things that, because you mentioned also with regard to the creams and the lotions and going now for relaxations, and at this time you're feeling a little bit better, but you also want to enjoy this honeymoon phase of your pregnancy. Things that we need to stay away from, as explained within the first trimester, there were a list of things. And I think throughout the trimester, the really strong aromatherapy oils and stuff we also need to stay away from. Any sort of alternative holistic therapies and stuff that we should be a bit cautious of?
Most of our spas nowadays are cottoning onto the fact that pregnant women need pampering as well. And you'd catch me off guard in the program because there are certain, and it's very confusing, and those people, confusing to me rather, those people who are massage therapists or aromatherapists and that know exactly which oils are ideal and which oils you absolutely need to stay away from, So you'll find sometimes they'll say, we use bio oil, or, like one of the tissue oils that are around, that we actually use that, because certain of those,
very potent.
Absolutely, because certain of those is not really helpful. So yes, it's okay for you to go for a massage. It's just check that it's reputable, and they are aware of which oils and that you should be staying away from.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. We're in our last little bit when we look at our second trimester, inshallah, with Dr. Malika Fangaske. Doctor, just before the break, we were talking about pampering. Very important. We cannot leave that out. So multiple birth issues, and with that, visiting the gym, does come infections maybe, and just trying to be cautious about that.
Yes.
Often in your pregnancy, there is also that worry of this extra changes within your body, and one being vaginal discharge.
Absolutely. That can often be the odd phone calls that I'll get. I mean, really, it would be a week does not go by that somebody would not call concerned, not knowing when should I worry, when should I not worry. And I think, women especially start to worry at this stage in the second trimester, because they are starting to realize that, that perhaps preterm labor could happen. So they often think or confuse physiological as in normal discharges, thinking it could be that mucus plug, exactly, or the show that might be that we talk about that's coming down. So common and so difficult to judge who's going to be who. Some women, and as it generally with women's health, different women have various degrees of vaginal secretions or discharge that bother them. Not all of them is infection, not all of them is a sexually transmitted infection, not all infections are innocent, So, the commonest complaint would be an increase in vaginal secretions or discharge. And the patient doesn't know, am I worried? What should I panic? Should I be phoning the gynae? What should I be doing? And, there's a couple of things that you need to know. Yes, as everything is growing, and especially in the second trimester, part of the physiological changes is that the mucous membranes, and you are going to be secreting more vaginal secretion, so there will be more discharge. And ideally, it should be the same color, consistency, odorless or odor that you are used to. And that signs of a problem would be if it changes its consistency, color, and odor. So one of the commonest infections that we find would be your candida or thrush infection, and that you need to realize is and again, I've mentioned before, everything in medicine gets compared to food. So it would be this thick, cottage cheesy, lumpy white discharge, which causes rawness or irritation vaginally and actually causes excoriation and itchiness. It can be a variation of burning and itchiness, and it is very common in a pregnancy. Sometimes you can be afflicted with it throughout the pregnancy. Some women have terrible problems with it, and sometimes you can be lucky enough not to have it at all. And there's so many different causes. It's a pH change. It might be if you've been having excess amount of sugars, if you're using something too antiseptic to wash with, like a really harsh antibacterial soap. It could be from a lack of yogurt in the diet often, the sweet stuff, as I've mentioned before. And often if we do end up giving patients any form of antibiotic, most patients will know thrush is, and women will know thrush is a side effect, where that is concerned. So it can often be solo and all on its own, and that is easily treated. There are over-the-counter formulations, and please check with your doctors as well before you do this. You can have your vaginal suppositories that gets inserted, so you can have a single pill that can be a once-off dosage, or you can have some creams that get drawn up all the time and get inserted. And then the thing to realize is sometimes that thrush infection goes away, so that consistency of that discharge changes, but the excoriation or the rawness of the skin doesn't. So that's sometimes why you need that creams for up to 5 to 7 days, if not longer. And this would be if it was run-of-the-mill vaginal candidiasis or thrush that is, influencing things.
Now, besides the infection and this vaginal discharge and what we should be kind of wary of, it doesn't influence the
pregnancies.
Yeah.
Well, if it is only thrush, Yes and no. Yes, it can affect the pregnancy in that sometimes it's not going to cause your preterm labors or anything, but it can irritate the mouth of the womb, the cervix, so it can sometimes cause a bit of blood or bleeding, or a blood mixed with mucus, and then it becomes this worry, oh my goodness, is this preterm labor, where that's concerned. That's firstly. And most of the time, if you think something like this influences a pregnancy, it might be because there is an additional infection there. And there is one bad vaginal infection that we worry about, and that is an infection called Group B strep. And it is Group B beta hemolytic strep that affects the cervix. Now, the problem with this is it can be silent. It doesn't necessarily have to be a particular discharge, a particular color. And why? Why bother? Why am I telling you kind of thing? Is because it can sometimes be the result of preterm labor or pregnancy loss in and around 24 weeks or after. And it can sometimes colonize the vagina. So what it is, it's a bit of a difficult concept to explain, but it is an organism that you might naturally have, but you have a particular profuse overgrowth of it, which causes a problem within the pregnancy and within the vaginal canal. So this can either be silent, and then sometimes these babies are born vaginally, or even sometimes it's Caesar, and they can get problems they can get an infection, and the baby can get quite ill and quite infected when they are infected with Group B strep. So it can cause meningitis, pneumonia, and just a general septicemia or infection with a neonate. So it can be a very ugly bug. And it can sometimes get easily treated if we pick it up. It's just that sometimes we're not alerted to it. Not every discharge is going to be a Group B strep,
You have to test for it.
Absolutely. You have to test for it by doing a vaginal swab. And actually the latest teaching is that you don't just do one. You have to do 3 different types of swabs to sometimes get a good yield for this, to get a positive result. But if we are alerted to it, we will do it. If the patient comes in perhaps with preterm labor or continues to complain of this vaginal discharge, and some of the normal little remedies that we've given has not helped to try and stop this.
Yeah. So what would be the reason for getting Group?
Well, it's not necessarily sexually transmitted. So it's not that. It's not poor hygiene or bad hygiene or anything like that. It's just luck of the draw. It's just the cards you've kind of been dealt where this is concerned. So some countries, they routinely check for that. We sometimes do not have the resource or the infrastructure to be able to do that. And nowadays, as I said, with the latest teachings are, you need to kind of do a swab on the upper third of the vagina, the lower third of the vagina, perhaps around the rectal area, just to try and pick that up. So we'll do it in our candidates where we are suspicious. And the pediatricians are excellent at testing the baby for this very quickly. So sometimes what they do is before that child starts to suckle and get breast milk into the stomach, they might aspirate a little bit of fluid from the stomach and send that away. Or if there's any signs of infection with the baby, they can test the baby's urine quite quickly to figure out, does this child need any antibiotics? And this would be something they'd screen just as that baby's born. So, as you can see, easy discharges, absolutely detrimental. Terrible discharges, the spectrum can go from one end to the other.
Our segment is almost done, but I need to throw in this question quickly.
Okay.
Do you get anything from your baby? Do you, when it comes to the baby's in its own little sac, it's private, it's connected to you via the umbilical cord. Is there any sort of disease or...
Probably just that rhesus disease that we were talking about that influences that. And of course, how you medically sometimes could get influenced, as in, if you have, if that pregnancy is under stress and you end up having hypertension, to try and balance that out, and those are the severe, serious medical conditions that can happen.
So inshallah, we will be wrapping up the segment, at least with the second trimester, in our next show. Anything else we need to know, stay away from, that would help us just better our pregnancy within our second trimester?
I think antenatal classes, if I really think of something, but we can discuss that further, definitely.
So that's definitely the thing. You mentioned Pregnant Bellies, Pilates classes,
aquarobics, physio, if you need it. Don't forget to pamper yourself. Moderate degrees of exercise is also quite acceptable in this phase, and just try and reclaim some of yourself now that you're no longer feeling miserable and nauseous and really ill.
Shukran so much once again, Dr. Malika. Always a pleasure having you and hosting us here at your Wonderbosh rooms.
Only a pleasure. Thank you so much.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
A big shukran to Dr. Malika van der Skye, a gynecologist and obstetrician practicing out of the Kutstancheberg as well as Wonderbosh Medical Center here in Cape Town. Stay with us for our next episode as we look at the ailments, the medical ailments that does come from pregnancy. Those big diabetes, hypertension, which only happens within pregnancy, the legs, the cramps, all of that in our next episode. This is Pregnancy to Parenting. I'm Hawa Solomon. Wassalamu alaikum wa rahmatullahi wa barakatuh.